Two-year-old boy presents with recurrent infection, silvery hair, horizontal nystagmus, pale skin with scarring. Peripheral blood smear is shown. This patient most likely has which of the following disorders? The symptoms that this patient is experiencing is characteristic of Chiari-Higashi syndrome. Now you can remember some of the symptoms that are associated with Chiari-Higashi syndrome with the mnemonic plane. So the P is going to be for progressive neurodegeneration, the L is for large granules that we're going to see, A is for albinism, I is for infections, and the N is for neuropathy. Now in Chiari-Higashi syndrome, we're going to have a defect in the LYST gene, and this defect in this gene is going to result in microtubule dysfunction. Now, this microtubule dysfunction is going to cause all the symptoms that we kind of see clinically in this syndrome. So let's start off by discussing the infections that we see in the patients. Now, in order for neutrophils to clear pathogens, for example, it needs to take in the pathogen with the phagosome, and then ultimately the phagosome um, is going to fuse with the lysosome. So imagine that this is the phagosome, imagine that this is the lysosome, and this is the pathogen. In order to do oxidative killing, we need to merge the lysosome with the phagosome and form a phagolysosome where we do the oxidative killing. Now, if we have a microtubule dysfunction, then we're ultimately not able to form this phagolysosome, and as a result, patients experience recurrent infections. Now, neutrophils, as well as other white blood cells, contain granules that can degranulate and release enzymes um, to aid in the inflammatory process. But if we have a defect in the microtubules, then we're not able to send these granules into the periphery, and as a result, they're basically going to build up. And that is actually what we saw in the question. So if we were to go back and look at the picture, we see all these granules that are built up in this neutrophil. And the cause of this is because we have a microtubule dysfunction and we're not able to send these granules to the periphery. And so as a result, this is going to be a classic histological finding of Chiari-Higashi syndrome. Now, it's the same idea with the albinism that we see in these patients. So imagine that this is the epidermis, and then in the epidermis we have these keratinocytes. And in order for us to see pigment, we're going to need to send in melanin into these keratinocytes. So because there is a microtubule dysfunction, we're not able to bring in melanin into these cells. As a result, that is going to cause albinism. Now, it's the same idea with the peripheral neuropathy and the progressive neurodegeneration that we see in these patients. So in order to nourish our nerves, we need to send in, so imagine that this is a person, and in order to nourish our nerves, we need to send proteins into the periphery and the appropriate sites for the nerves to be nourished. And if we can't do that because there's a microtubule dysfunction, then that is going to cause damage to our nerves. So that is going to cause peripheral neuropathy and progressive neurodegeneration. So to answer the question, the answer choice is going to be answer choice B, which is Chiari-Higashi syndrome. Now, I put this as a reference. You can look up this disease on first aid on page 114.